Now, in my final year, so the third year when I was just working in general practice, I'd done all my hospital jobs. I'd worked in the busiest, craziest environments of A&E and babies being born and, you know, death and everything. And then I found myself in general practice, and you're on your own in your room. You've got your trainer next to you, so your GP who's like your mentor, who's your trainer. But you've got to make the final decision. You've got to decide, am I going to treat this with this antibiotic? Is this anything cancerous? Is this anything worrying? Yes, you've got your trainer next door to ask later, but ultimately the rest stops with you. And I just found that quite stressful. I found that quite daunting and overwhelming. So I definitely found that year quite hard, and we had exams in that year, clinical and written. And that's when I got a bit stressed and I had to take some time out because it all just got too much.
I found that the stress levels associated with not so much the operating as such, but rather just the role of the registrar was a lot more, because a lot more onus was placed on you. Mm-hmm. You sort of have to run the day-to-day tasks really of the kind of the elective side, but also the on-call commitments as well.
Imagine that you don't get told your rotation for your hospital sometimes until 2-3 weeks before you start. So you are in one hospital in like a couple of miles from your home, and then 4 weeks before you start your next job, your next rotation, you get told that you're somewhere on the other side of the country potentially. I mean, in which other job is there that level of uncertainty? So I think there's administrative uncertainty and administrative carelessness in some ways with our lives. There's also the upheaval of you and your family life from location to location. But there's also the shift work. I mean, one of the hardest parts is dealing with night shifts. I mean, before you become a junior doctor, you have no idea what it's going to feel like to work in the dark, like when everybody else is asleep, and the effects on your body and your circadian rhythm and your time, your body clock.
I've worked in A&E, I've worked in major, you know, trauma, you know, stressful, and I'm feeling really overwhelmed and stressed here. And it was the stress, the responsibility, the risk, the unknown, because in general practice you haven't got everything at your disposal, whereas in hospital you can do bloods on anyone who walks through the door, you can do an x-ray, you can do a scan and make sure there isn't a blood clot and make sure there isn't cancer. Whereas general practice, it's very much more, so hospital specialties are very black and white. And general practice, it's like an art, it's like a grey, area of grey, and if you can't deal with uncertainty, it's probably not the best career for you.
So I resigned my training number halfway through my second year of being a registrar, which was a combination of internal factors and external factors. The internal factors being how I am as a person, my personality, and how an individual needs to be to have a career as a surgeon. So my perception is, and my feeling is, that those individuals who empathise less, are less sympathetic, for want of a blunt phrase, care less, have the ability to become far better surgeons, because they're far more removed from what you're doing to them, but also to the problems that can arise. And I found myself losing sleep and thinking a lot about a lot of patients, and finding some of the things that I was seeing and doing difficult to process. So that was kind of an internal factor. Also, I had seen surgeons who were probably similar to myself from a personality perspective, really struggling in theatre, and this was demonstrated by their behaviour, which could be shouting at people or getting highly stressed and, you know, throwing the toys out the pram. And I didn't want to become someone who was unpleasant to work with or who was bitter. So that was my kind of internal reasoning.
So the nature of the work as a day in the life of a doctor is one of constant demands. Nurses asking you questions, patients, relatives, consultants, having to keep your medical knowledge up to date, having to respond to emergencies and then go off and have your lunch, having to certify someone who's passed away and dealing with the emotion of that, only to then go off and, you know, save someone else from their deterioration and their condition. So there's a lot of variation, there's a lot of unpredictability, there's a lot of uncertainty. The hours make it tough because of the long hours that you work.
A&E was tough, again, for the hours and the shifts.
The jobs that I was doing had a lot of out of hours work, and by out of hours, anything that's beyond 6 o'clock in the evening, you know, running through to 8 o'clock in the morning. So a lot of days in the hospital that were 12 hours and a lot of nights in the hospital that were 12 hours. And that working pattern was totally new to me and took a while to adjust to.
Shift work, weekend work, night shift work makes you miss birthdays and dinners and all sorts of social things.
And that was hard for me because I'd trained to be a GP, I'd put in all the hours and everything, and I was trying to, again, persevere, you know, trying to work through it. And I think I had lots of time off sick in that third year, but then ultimately in March, I had to just take the time properly and go back when I felt ready and everything was okay.
So I couldn't say that burnout occurs at a particular age because I don't think burnout is chronological. I think burnout occurs in cycles. So for me, there was burnout at medical school. It was a cycle. There was even burnout on my first day at medical school. So there are hours, days, months, and years of burnout cycles. So burnout at medical school was definitely there. Burnout as a junior doctor from day one was there. Burnout as a senior doctor is there. And each time the cycle changes, and sometimes your threshold for stress goes up and you develop more capacity to handle more stress, or so you think. So I think that a burnout is a cyclical thing rather than a chronological thing.